Good afternoon, everyone. Thank you so much for joining our webinar. My name is Stephanie Uberall. I'm a Deputy Program Director here at the Council of State Governments Justice Center. And I'm joined today by a great panel of experts to help us talk about how policymakers can leverage and coordinate initiatives to really serve youth and families more effectively around prevention services and supports. So today we are joined by Brett Peterson, who is the Director of Utah's Division of Juvenile Justice Services, Marissa Henn from New Hampshire, who is a Deputy Commissioner from the Department of Health and Human Services, Betsy Fox Tolentino, who's a Managing Director at ROCA, along with James Timpson, known as JT, who's also a Managing Director at ROCA. And so today our webinar is Navigating Concerns on Youth Crime, Violence, and Behavioral Health, 3 Steps to Take, which is part of a wider series, and I'll share links to these resources in a few minutes. And we're really here to hear from our agency leadership and community providers on their perspective and things they are actively working on. Next slide, please. So we are the Council of State Governments Justice Center. We're a national nonpartisan nonprofit, and we work with states and counties across the country to help improve outcomes around community safety. And I work on our juvenile justice team, and we partner with states and counties to conduct comprehensive system assessments and improve outcomes for young people that experience the juvenile justice system. Next slide. And so the information you're going to hear about today is informed by our team's most recent behavior analysis around behavioral health, arrest, and juvenile justice data to really help policymakers better understand current national trends and place them in historical context and identify key implications. And like I said, I'll put more links in the chat around this. And so from the analysis that we did, there are 3 main takeaways. So first, we really saw that our young people are experiencing increasingly negative outcomes around mental health, school, and community violence that's really impacting their well-being. So for example, about 5 million young people had at least one major depressive episode, where about 3 million had a severe episode, and half of these young people did not receive treatment. Next slide. Another key finding is that youth arrests for violent offenses overall remain historically low. However, post-pandemic, youth arrests for homicide and weapons, including youth victimization, surged. Early data from 2023 and 2024 show that these numbers are dropping significantly, which is really good news. Next slide, please. And thinking about all this in context, the juvenile justice system should really focus the limited resources it has on young people that have committed more significant harmful behavior. However, when we look at who is involved in the juvenile justice system, we see that most young people are arrested and detained and incarcerated have committed offenses that don't involve physical harm to another person. So for example, 70% of youth arrests are for a non-person offense. And the same is true for more than 60% of young people on probation and more than 60% of youth that are incarcerated. So these young people have not committed physical harm against another person, but are experiencing the juvenile justice system. Next slide, please. And so we know that, juvenile justice involvement for our low and moderate risk youth really creates negative outcomes for young people across a wide range of indicators. So when low and moderate risk youth are processed in the juvenile justice system, they're more likely to be rearrested and incarcerated. engage in violence, have more peers that are involved in delinquency, lower school attainment and graduation rates, fewer skills to manage their emotions, and have a lower perception of opportunity. Next slide, please. And so instead of the juvenile justice system being a backstop or a way that young people are able to receive services, jurisdictions can use the data that we publish to really achieve two important goals. So one is to refocus the juvenile justice system on young people that do engage in more harmful and serious offenses, to ensure that these limited resources are invested in programs and practices that demonstrate that are effective to reduce violence and improve safety and youth outcomes, and also for folks to really work together to develop a statewide plan that coordinates services and funding across the variety of needs young people have. And so to do these things effectively, one key component is ensuring there's strong agency leadership and community and multi-system collaboration. So now I'm excited to turn to our panelists and engage them in a discussion where they're going to share some of their key efforts to really leverage and coordinate existing funding and initiatives across youth and family service systems and create statewide structures for our young people. So Brett, thanks so much.
All right, thank you. Great to be here. So just real quick, so I'm Brett Peterson, Director, Juvenile Justice and Youth Services here in Utah. This just demonstrates kind of our continuum of care. Utah is not completely unique, but we don't have county partners in the juvenile justice space, at least on kind of the formal side. It's myself and the juvenile courts operate kind of the continuum. And when I think about those slide decks that you just walked through, the thing that's so powerful for me is that I've had the opportunity to walk through, policy reform efforts here in Utah with our own data that just mirrors that data, right? Like just one for one. Like we had kids, a big group of kids that would get diverted for offense X or Y, and a group that wouldn't. And we were able to watch and look at those outcomes. And so it's really powerful to see that, also kind of dialed up on a national level. So for us, when you start this kind of journey of rethinking how you can approach care, I always want to start with like every jurisdiction is going to be in a different place, right? And I think that's okay. You just start where you're at, right? And I think that everyone can make strides regardless of where their system's at, but it's going to start with an understanding of kind of the philosophy in the state relative to responding to youth, and whether it's responding to youth violence or delinquency in general or challenging youth behavior, what's the philosophy? In Utah, like there was a culture of positive youth development within our agency. I think within the community, and I don't think that's unique. I think everywhere has that general kind of concept of we want kids to thrive in their home schools and communities. But how do we translate that into justice work and justice reform, I guess you'd say. And then for us, and then you got to start getting into the policies and then ultimately the practices. And I think that's the thing I'm going to highlight today is some of that practice work. So for us, the policy was, hey, you can't detain kids for, we're going to draw a clear line in the sand of when you cannot detain them. And also we're going to draw a clear line in the sand of when you have to offer a diversion. You can't process them formally. So, when that happens, it's not hard to get your detention numbers to drop. That's the reality. Like if a law was passed tomorrow that says you can't incarcerate for, offense A through Z, well, you can get your detention numbers to drop. I think the trick is how do you sustain those types of policy changes? And that's always going to be in the practice and the partnerships too. I would say both. So for us, what we really started looking at, and I'm going to look at kind of on my screen, the left of this continuum, it's that youth services, which is our early intervention. We started looking and saying, okay, all of these low risk offenses that really never made sense to be in detention or to be in courtrooms, we're going to use some policy guardrails to make sure that they stay out of detention, they stay out of courtrooms. But we had a lot of partners, right, that also had questions, that also had concerns. And I think sometimes, they're legitimate concerns. If they've relied on the traditional system, if you're a school principal and you've relied on the juvenile court to deal with truancy, then when that's all of a sudden removed, they have a legitimate question of, well, what am I going to do? And I made the mistakes personally where at first I was just like, well, how dare you use court for truancy, right? That only goes so far. So instead, we started leaning in, and my counsel or thoughts to anyone who's walking through these challenges, lean into your partnerships and lead with listening. Start asking the questions. What is it you appreciated about the formal system that you're worried you're going to miss now, right? So as we start having those conversations, really what it was, all of these different partners on this kind of front end of the system, the stuff they were identifying was care coordination. It was some type of, or case management. It was some type of individual, a person that will help navigate. Now, that had gotten conflated with a belief that somehow the court or detention was solving the problem. And we're like, no, that's exacerbating the problem sometimes. Let's see what we can do to get you connected to that service. So we stood up, you can go to the next slide. So statewide, we stood up an early intervention model, and we were able to redirect all of our savings from policy change into this early intervention model, which, this is just from my website, but youth service is the moniker we use. And I know that could be different for every jurisdiction, but basically it's a no wrong door approach. It is a voluntary service. Anybody, like you all could get on my website right now, you could make a referral. So a principal can make a referral when they have that young person that, maybe they've went through the PBIS kind of behavior tiers in a school setting, and now they're like really bumping up against, expulsion or some other challenge. They can make a referral. A parent whose 13-year-old is running away or doing some other things. Like I said, this is all kind of that front end stuff we're talking about. We can say, look, get a referral to us. Our staff, who are these youth services staff, they will go out and they'll respond. It's completely voluntary, and they just start engaging with the family. And it's just a basic like screening, light touch model of like, okay, what are your needs right where you're at? And then we'll start building out a youth and family plan based on their needs. It can include after school programming. It can include, we have the ability to provide more formal, treatment. If FFT is the right thing for that family, because of some of the changes we made on the deep end, we're able to do that so that we hopefully don't see, that reversion back to the ultimate safety net of correctional settings, right? And I don't say that meaning it's the right safety net, just knowing that it is the safety net that ends up being deployed when kids just kind of funnel through. And a lot of times then they do engage in something that is really harmful, or it does have a big reverberation in a community where it's like, yeah, there has to be some type of response. But man, if we could have, we all know this, right? It's like, if we could have just got it up here, right? So if you go to the next slide, I'll talk a little bit about how this has worked so far. And it's pretty powerful to see and to be a part of it. And it's definitely the thing I've been the most proud of in my time in this role of bringing this online. So you can see on this bottom line, this is our admissions to detention. The bottom, the red, you can see this continual decrease, this 59% decrease. This is going back to 2017. 2018 is when our big policies came online. That's that first red line. The green line shows the increase in these referrals to these early intervention programs. So it continues to grow, and it continues to grow every year. This is through 2024, FY24. If I pulled up the data today, it would also grow. What's more inspiring to me is if you go to the next slide. So what this demonstrates is, we use the term nightly counts, but it's the same as saying days in service. So you can see this green line. These are these early intervention services. You can see this increase of days in service it's over 300% increase. What that indicates is these are not just one and done. These aren't just referrals. Thank you. See you later. These are young people and families, and these are voluntary services. They are engaging in services. And so that's what's driving that nightly bed count or days in service count way up. That's exactly what we wanted to see. And when we set out doing this work, and this is like a lot of stabilization work, this is skills. I mean, this is, if it needs formal treatment, great, we'll navigate that. But what we wanted to see, we wanted to see kids stabilize at home, not come into court, no probation, certainly no JJ custody. We also wanted to help with child welfare custody. And I can say today, we serve thousands and thousands of young people in this space in Utah. Of about 1,000 youth that completed services last year, when we look back 6 months later, it's like almost 100%. It's 98 point something percent avoid those three indicators we look at. And it's statistically significant, the difference from kids who are referred versus kids who are screened, assessed versus kids who actually engage in a youth and family plan. And so we're seeing this wonderful outcome of those kids who engage in that youth and family plan. So this is all in the same time that we are also on the deep end. We are seeing some of those spikes in gun violence. But these are those types of things that we have to say, okay, what can we continue to lean into to still serve and think about the majority of these young people, to keep them out of these spaces if possible, so that when there is something like, a homicide, we do have some of those other resources available, to be a little bit more strategic and focused. Just to reframe the conversation back to what your slide said, how do we talk about public safety? Let's just keep going back to public safety. So I didn't know how much I was supposed to cover, if that's enough, or if you want me to, I can cover whatever. I mean, you say it.
No, that's great. There's like a few questions in the chat though that I think would be good to kind of touch on. So first is about the staffing. So Jen asked a question, are youth service staff different than juvenile justice staff? If not, how do you ensure people don't equate referrals to youth service or early intervention as a referral to the juvenile justice system? The second question is like, how are community agencies able to refer? Are they releasing information? Do you need parental consent? And the third question is about is early intervention available for status offenses like truancy?
So yes, yes, and yes. So first of all, the staff are, they go under that. We actually changed our agency name. Our agency was Division of Juvenile Justice Services. We changed it to Juvenile Justice and Youth Services. So this whole group of individuals, and it's about 100 100 full-time staff statewide, actually might be down closer to 80 now. They are all specifically classed that way. They're youth service workers, in the community. That's what they do. There's definitely because we also operate like receiving centers and some shelters. So there's great continuity. Sometimes a young person might be brought into a receiving center for a low risk offense that's not bookable, but they were arrested. We can still get them, connected to some of these early intervention services. So that's who the staff are. The referrals made, they really are like, yes, it will eventually need a release, and we will contact the parent and the family. And the population that's served here too is like, we set out thinking, oh, this will be, I don't know. I think we thought maybe 14-year-olds, 13-year-olds was like that. A lot of times it's 12-year-olds, 11-year-olds, and we have to be thoughtful about that and continue to like, okay, now we're dealing with an 11-year-old versus, a 14-year-old. But we will work with the family, but the referral is really easy. And, the schools, we have agreements with them to be able to, interact, and we join in some of the school districts in Utah. We actually joined some of the staffings. And so it's gotten even more integrated. That's the most like powerful model. It's just that more comprehensive teaming approach, where we might not be the right fit. And when we launched this, we just said, this was right on the heels of these big policy reforms where they were not like super popular, right? Like, and so we're like, look, we'll step into these other gaps as needed. As we've kind of continued to evolve and solidify this practice statewide, what we found is, the referrals that are coming, I would say they're the right referrals. Like these are young people they've gotten a lot of other interventions before entering into this space. And so the other question was on the truancy. Yes, this can be a referral for truancy. And then it's going to be individualized. We're going to, screen and assess, and truancy is mostly caused by a lot of underlying situations. Not always, but mostly it's not as straightforward as just a kid not wanting to go to school. So definitely that is a group that we will work with.
Got it. That's super helpful. And can you talk a little bit about how you are coordinating with other existing agencies, whether it's child welfare or if you have a behavioral health agency, and how you guys are working together?
Yeah, so I won't get way into on the behavioral health. We coordinate if, especially if they're Medicaid eligible, we will coordinate. And just Utah's Medicaid structure is a little different. Yeah, I won't go to that. That'll be too much for my own brain. So, so we coordinate like, okay, you come in the door, you're Medicaid eligible. We're going to coordinate with that community mental health provider. If they're not Medicaid eligible, then we're going to be the ones. We'll see if there's no other insurances. We'll be the ones helping, and navigating that to our behavioral health providers if that's needed. The other types of coordination, for example, Child Protective Services, they have their hotline, right? In Utah, it's been a coordinated effort. The same time when we're trying to kind of shrink the doors of detention to make sure it's really focused on public safety, they've also tried to shrink the doors into child welfare custody, trying to say, look, let's focus on abuse and neglect. Let's try to chip away at these kind of CHINS petition type. We use the term dependency in Utah. So when they get a call to Child Protective Services, and it's a family call, and it's like, hey, my teenager's out of control. As they screen it and work through it, if they realize there's no abuse or neglect, they make a referral to us. And so we'll call and kind of pick up from there and go. So that's one example of that type of coordination.
That's great. Thank you so much. Okay, I think next up is Marissa.
Great. Thank you so much for the opportunity to tell a little bit of New Hampshire's story, which shares a lot of characteristics with Utah. So it was great hearing Brett's insights. So we can go on to the next slide. I wanted to tell New Hampshire's story. I think it helps to start with where we were, similar time frame as Utah, kind of pre-2016 versus post-2016. Prior to 2016, New Hampshire's juvenile justice system was largely reactive and coercive. It was focused on the risks that kids have at moments of crisis, not because anyone wanted it to be that way particularly, but just that's how the system was designed. So in essence, our child welfare and juvenile justice agency, which all falls under New Hampshire Division for Children, Youth and Families, DCYF, was becoming the de facto public mental health system. So if you wanted services for your family, you needed to basically have a finding of abuse or neglect, and that was the gateway. The system that we've built since 2016 has been quite different. It's been grounded in prevention, response, and in building on the strengths that kids and families bring, in a very similar spirit as Utah. And I'm going to talk over the next few minutes about some of the key ingredients of that transformation. But essentially what it comes down to is building alternatives to juvenile justice system involvement, something Brett just talked quite a bit about, making sure we're understanding what those underlying needs are before families come through the JJ door, intentionally diverting and deflecting those who do come into our system, and then individualizing care. So I'm going to talk about these in a sort of integrated way if you want to go to the next slide. So I think I'm going to actually jump right into kind of the moment of arrest, if you will, just to kind of bring you into how our system has changed. So before the law enforcement can file a delinquency petition in New Hampshire, we, like Utah, put in some of those policy guardrails. And one of the key changes that we made was requiring that law enforcement make a referral to the Department of Health and Human Services to have a voluntary needs assessment completed for that child. So the family doesn't have to participate, but in most cases they do. And what happens is that assessment, which is known as the CANS, the Child and Adolescent Needs and Strengths Assessment, looks at what is actually going on for this child and family. And you can see in the blue circles the components of the CANS that are completed. What we basically find out from this is what is happening. What are the actual needs? Exactly as CSG has helped lead in sharing nationally, in most cases that crime that has occurred, that involvement with police, with courts, has come about because of trauma and adversity and victimization. And so what we often find through the CANS is we find issues of family stress, poverty, impulsivity, challenges with school. What the CANS also does is it recommends a direction, which more often than not is behavioral health services and the various types of youth services that were discussed earlier. Oftentimes what kids need isn't to go through the court system, but is to be involved in a sport, to have a mentor, to participate in a restorative activity. And so it turns out that police were not required to follow this CANS, but 94% of the time, the police are agreeing. And so what has resulted from just this one policy guardrail, to use Brett's term, is an overwhelming drop in the number of youth who are going through our court system and ending up in our custody. And so you can go on to the next slide to see some evidence of this. Or actually, before I get there, I think one of the things I want to emphasize is it's not just about assessing needs, it's about addressing needs. So for those kids who maybe have been arrested, but also for kids who hopefully pre-arrest are having issues, maybe aren't attending school or showing some signs of need, we have developed a children's system of care. It is not based in our juvenile justice or child welfare agency. It's based in our Division for Behavioral Health. We did that very intentionally. We can talk more about that. And what it's really meant to do is to avoid having families need to go through the juvenile justice or child welfare door and instead address their needs, whether that's community-based services, outpatient services, all the way up to the more acute crisis and inpatient offerings that sometimes their needs require. It's rooted in very explicit values that we integrate into everything we do. So going to the next slide, the point here is what we're scaling up, just like Utah, is the intensive family supports and kid supports. One of the most important interventions we've been using in New Hampshire is Fast Forward, which is our high fidelity wraparound program that coordinates and integrates care for a child and family. Usually families are engaged for about 12 to 18 months. And what we have seen is, similar to Utah on that increase in the service, we've been seeing tremendous increase in demand for this as our CANS assessments and as our juvenile justice diversion has occurred. I'll go to the next slide. We also have something called TREC, which is basically that same high fidelity wraparound, but this is for kids who are navigating transitions between care environments. So they might be leaving inpatient psychiatric care or residential treatment and returning to the community. So it's a very similar model of really wrapping around with their families and support systems in a very family-driven way, but it's specifically for kids who have had to be placed out of home for a time. Go on to the next one. So what has been the impact of those policy guardrails and of scaling up prevention and dealing with actual services? It's been, as Brett said, the very obvious drop in placement. So on the right-hand side of this slide, what you see is a major reduction in youth who are in detention in New Hampshire. We now have gone, in terms of that nightly bed count, from about over 100 kids locked up each night to around 12. In terms of residential placement, so these are short-term therapeutic programs, but also an out-of-home placement, we've also seen a dramatic drop. And I'll point out that these two visuals side by side is really important, because some people told us, if you're going to change the laws to make it harder to lock up kids, all you're going to do is you're going to end up sending them away to these faraway Utah, programs and res programs. But that is not what we've seen. And so I think it points to the same indicator that Brett referenced, which is we're actually dealing with helping families really grow stronger and more resilient, not just displacing kids from one environment to the next. So that's been a really important indicator for us. We'll go on to the next slide. So I want to just talk, in addition to the CANS assessment and all the work to build alternatives to juvenile justice involvement, all the work to build a children's system of care to help address needs before kids get involved in the juvenile justice or the child welfare systems. I want to talk about a few other really key ingredients. One is something called the revised conditions of release. So when youth are diverted from detention or from deeper juvenile justice involvement and they're put on probation, it used to be that there were 20 items. I shall this, I shall that. It was very intimidating. It was very easy to trip up youth in terms of basically violating the requirements of their probation. So this was completely reworked in collaboration with the courts to really focus on the essence of what matters the most, and to give kids and families the opportunity to design with our system partners an individual plan made up of explicit goals that make sense to them and that reflect what's important to their family and their values. So this addition of simplification to make it much more likely to avoid, rearrest, and also this individual plan has really been a game changer when it comes to saying, what do you want as a family? Maybe you want to participate in a sport or to have some other pro-social activity. Let's focus on that as the goal, as opposed to looking to trip you up on some punitive set of measures. A second thing I want to mention, and we can talk more about this in the discussion, is what a huge driver Medicaid is for us. We have lots of things going on in Medicaid. One that I will call out for this population is a 1915I waiver. It allows us to offer those enhanced wraparound high fidelity programs I mentioned for virtually 80% of the population that comes in needing that service. It's not a cheap service. It costs about $50,000 per family per year to deliver that. And through this waiver and other changes in Medicaid, it's not falling exclusively on state budgets. We also are one of the first states to fully implement juvenile reentry. So when kids are as I mentioned, we're down to about 12 kids a night who are locked up in detention. But those 12 kids, when they leave detention, are having Medicaid turned on for about a month prior to their discharge, allowing us to do a lot of that service provision and preparation to support them as they return to community. And then finally, we're pretty excited in New Hampshire to basically stop doing correctional incarceration. We have plans and have begun building a 12-bed therapeutic home-like facility that will fully replace our current 144-bed correctional detention facility. So super excited for the symbolic achievement of that, but also the fact that it really reframes this as these are kids with behavioral health needs and social needs, not criminals in need of scaring straight. So lots of alignment with, I think, Utah's experience as well. So I'll stop there.
Thank you so much. That was really great to hear about you. There were questions in the chat. I think you answered all of them throughout your talking points about how some of these services are funded. And I just want to plug two things. So the probation condition reform you guys did is really excellent at the state level. We worked with New Hampshire on a project that I just put in the chat, really helping us showcase to other states and counties what's possible. Because as we are discussing, once young people are under supervision, they then have a long list of rules. A lot of the time these rules are like, be a perfect teenager, and it's really hard to focus on like 25 things, 40 things, however many conditions kids have, and instead really tailoring it to their needs and goals to really ensure that we're working on a targeted set of behavior change. Like all of us adults, when we get a performance review, we have like 3 goals, right? We don't have like 400 things we need to do. So I just want to put that out to everybody on the webinar that there's, yes, early intervention, and also for when our young people are involved in the juvenile justice system to really ensure that their conditions of supervision are tailored and developmentally appropriate and realistic, and they don't conflict either. So making sure you guys review those. And you also mentioned the reentry piece. And so this, there is a new requirement for states that that there needs to be reentry planning for all young people leaving any type of facility, whether it is a state incarceration facility, a detention facility, or non-secure. And so I know states are working on that Medicaid requirement right now. And so I just wanted to highlight that is moving forward in every state. Okay, I think now we're gonna turn it to Betsy and JT. So thanks so much.
Good afternoon, everyone. Thanks for having us. Thanks to CSG for putting us all together. And awesome presentations, Marissa and Brett. I learned a little bit too. It's really great to hear your work. I'm Betsy Fox Tolentino. I'm the Managing Director of our Juvenile Justice and Young Adult Initiatives at the Roca Impact Institute. Prior to working at the Institute, I was the Deputy Secretary of Community Operations for Maryland's Department of Juvenile Services and a public defender and attorney in dependency proceedings before that. And I'm going to pass it over to JT to introduce himself, and then he's going to kick us off.
Good afternoon. I'm JT. I'm Managing Director of all our community violence intervention programs at the Impact Institute. And before that, I was just a guy doing this work, working with these kids that we're talking about, working with these hard to reach, hard to serve kids. So I've, done all the community violence intervention programs and, have case managed a lot of the kids in these programs. So pleasure to be here. But I'm just going to talk about Roca and our direct service model a little bit, the two components of Roca. But this is our mission right here. You can see what it is. It's really about engaging those young people, the police and the systems, because we really want to work with those who are close to these young people. We really work with a truly high-risk population because we know that if we target those, we can really help them heal their trauma. We can find different ways to remain hopeful about what can happen, and we can, drive change. So that's really what we're focused on, is how do we build relationships and really help young people who have been highly traumatized due to no fault of their own, a lot of times, find ways to change without being penalized or without being held accountable, without understanding why. You can go to the next slide. So these are our two sides of the house. We have the direct service model. And I started as the co-founding director of the Baltimore direct service model in 2018 when it first opened in Baltimore. We have over 7 sites across the U.S., though. We've been around for 36 years. We have 5 sites in Massachusetts. We have a young women's site in Hartford, Connecticut, and we have a young men's only site in Baltimore. But some of our sites do serve both. And my video is freezing again, so I'm just going to knock my camera off. And we do serve both young men and young women at some sites. Some sites we are specific to young men or young women, just depending. Baltimore is the only young men's only site. Hartford, Connecticut is the only young women's only site. The other sites service dual. We service young people 16 to 24 generally. Yes, we can go lower. Yes, we can go higher. It just depends. But our service model is based around research and brain science that tells us that 16 to 24 is that sweet spot to really be able to promote that behavior change. And at the Impact Institute, what we decided was that we weren't going to replicate the direct service model all across the country, but we did have best practices that we could share with programs who are working with this group of young people to really help the group of young people they're with promote and drive change through the tool that we use, which is our adaptive version of CBT. You can go to the next slide. All right. And this is how we do it. So number one is really about creating this safety and sustainability. Like, we're relentless with this group. Like, we understand that this is a hard to reach, hard to find population. If a kid can show up on his own, and he shows up on his own, and he's consistent, and he shows up every day, then he needs to go to the Boys and Girls Club. He's not a Roca kid, right? If the kid is ducking me out, I can't find him, he telling me he don't want nothing to do with me, he's slamming the door in my face, that's the one I want. Welcome. That's what I say to him. Welcome. You don't want us, but we want you. right? And so we're really relentless in the way that we go after them, the way that we hunt them down, because that's what it really takes. They want to go to programs where they can get kicked out for bad behavior. They want to. They don't want to be in the program anyway. You don't get that luxury here. Bad behavior, we love it, because that's what we need to get to. We need to get to all the bad behavior so we can help you figure out what's causing it, right? So we really spend a lot of time up front finding them, building relationships, providing basic needs, and then comes in the hard part, or the fun part, I should say, because it's hard work, but it's fun, right? It's really about how do we help these young people change? How do we help them realize and tap into the best in them? The way that we do that is by using CBT, our adaptive form of cognitive behavioral therapy. We made it a theory because we designed it to be taught by frontline workers or case managers, the ones who have the most contact with young people, and not licensed clinicians. Not saying there isn't a need for licensed clinicians, but think about the population we're working with. How many times are they lining up and going to the clinician's door voluntarily? They're not. We have to be able to provide them this behavioral health service in the community so we can start the healing process to help them get to the therapist or help them get to the clinical therapist. We do want them to end up there, but we have to help them get there. And mandates and court orders and stuff like that is not the way to help them get there. Because I'll tell you quite frankly, what my kids think about court orders and mandates, they could care less, right? They could care less about a judge's order or a judge's mandate. What they really want is somebody who really is going to really do something for them or provide them real services. So with that being said, that's what we do. We have this work program, which is our practice ground. We call it the practice skills relapse repeat, because we want them to mess up. I want you to blow up. I want you to have bad workplace behavior so that I can address it and correct it and help you figure out what good workplace behavior looks like. We want to challenge them on all the things that people say we shouldn't challenge them on, right? I come from this environment. I understand what these young people need. I've worked in there for a very long time. They want to be challenged. They don't want to live the way that they live, contrary to the way that we believe. We believe that they want to be involved in these things that they are involved in, but it's survival. They're stuck in survival mode. And once we start addressing the survival of young people, then we can start pushing the behavior change, and we can start seeing the actual behavior change outcomes that we want. The biggest problem that we have is that we continue to look for solutions in the behavior. The solutions do not lie in the behavior. The solutions lie in the trauma that's causing the behavior. So we have to start addressing the root. And by building these relationships and spending this time with these kids through this program, we're able to get to a lot of those root causes of the trauma and start addressing them with CBT, because CBT is a tool that's going to help address those issues and really help them start some type of healing. Then lastly, and before I turn it over to Betsy, is our engaged institutions piece, where we work with police, law enforcement, how I met Betsy, working with programs like DJS. When she first came, when we first came, she was one of the first people we went to, right? Betsy, hey, we need the worst of your worst. Send them to us, so, and, we have seen the transformation of systems, and we've seen systems start to work better with our population from that. I'll stop there. Hand it over to you, Betsy.
Thanks, JT. All right, we can get to the next slide. All right, so let me tell you a little bit more about the Roca Impact Institute. So that's where JT and I work, and we take these foundational strategies and bring them to different agencies, community-based organizations, even law enforcement around the country, to really sort of provide those strategies to help young people change their behavior and heal from trauma over time. So where did Rewire CBT come from? So Roca's been around for about 35 years. And when Roca started, we tried on a lot of CBT curriculums, because CBT is really one of the most researched and evidence-based ways to help empower young people to change their behavior. But a lot of the curriculums we tried required young people to sort of show up at the office, sit in a chair for 2 hours each week, maybe for 10 weeks. And guess what? The population JT just talked about is not coming to sit in a chair every Tuesday from 4 to 6 to get their dosage of CBT. So we worked with Mass General Hospital to develop a approach that is designed for frontline workers to be able to deliver CBT, cognitive behavioral theory, to young people wherever they are, so that almost every contact with a young person becomes this opportunity to teach a skill, to apply a skill, and practice a skill. So let me tell you a little bit more about it. We can go to the next slide. This is sort of the model. Everything is based on that our thoughts are connected to how we feel is connected to what we do is connected to what we feel. And young people sometimes get in these cycles of their thoughts driving their feelings and what they do, and they just spin, and they're spinning and spinning and spinning. And what we want to do is help empower young people, give them the agency, one, to know they're in a cycle, and then two, to disrupt that cycle, because oftentimes those cycles are unsafe, they're unhelpful, they get them into trouble. So if we can give them the skills just to slow down, sometimes just for 8 seconds, they may feel differently and do something differently. So these are the skills that we teach. Be present. It's all about the here and now, focusing on what's right in front of you, not what happened yesterday or what might happen tomorrow, but what's right here. And when we can hyper focus on what's in front of us, we build more control over what we may do. Then we have our emotional regulation skill, label your feelings. It's all about building up that emotional vocabulary, right? A lot of young people, they have all these feelings and they don't know where they come from. They don't even know that it is a feeling, but something's happening. So how do we help them identify what's happening? Noticing what's going on in your body, that you're having this extreme emotion. And it's not so much to build control of your feelings, because that's going to happen regardless, but it might help us build more control over what we do when we know where they're coming from. And then we have our cognitive flexibility skills, flex your thinking and solve it. It may shock you all, but right now you have a ton of thoughts going through your head. And guess what? Not all those thoughts are true. Not all those thoughts are helpful. So how do we help, identify those extreme thoughts so that we can reframe them? Because then we might feel differently and do differently. Solve it is really what it says. How do we take small steps to solve problems that we have control over? And then we have our behavior activation skills. Move it is straight out of the depression literature. How do we just charge that battery enough to do one thing when we don't feel like doing anything at all? When that young person does not want to leave the house, does not want to go to school, does not want to get off the couch. How do you help them just do that one thing to charge that battery up, to do the next thing, and then the next thing? Stick with it, which is one of my favorite skills, especially for young people who are justice system involved, is all about building up to do things that we want to avoid. Look, we are hardwired to avoid things that make us uncomfortable. So how do we build up the tolerance to do those uncomfortable things? And pretty much everything we ask young people to do in the justice system is pretty uncomfortable. And oftentimes they're like, forget it, I'm not going, I'm not checking in with my PO, I'm not going to court, I'm not showing up at the program. So how do we help them get there? And then understand that that's how we can also build accountability with them as we help them leverage all those things that they need to do. And then we have act on your values, which is all about aligning your behaviors with what's most important to you. If it's most important to you to get your GED, what do you got to do? How to identify when you're sort of not aligning your behaviors with what's most important to you so that you can slow it down and do something different. And we can go to the next slide. Look, Rewire CBT is all about putting this tool into the hands of frontline staff. Oftentimes our highest risk young people who they have trouble accessing sort of those services in clinical settings. This doesn't replace that, but it allows us to double down, right? And build skills all the time. There are 7 core skills. We just went through them. They're fully mobile. Look, Rewire CBT is meant to be taught whether you're on the street corner, walking down the hallway of a facility, sitting in your office, doing an intake assessment, in the detention facility, wherever you are. It's super accessible. And it's meant to sort of take all those awesome strategies, all those reforms that you're trying to put in place, and then build skills with your frontline staff so that you can leverage them all. Whether it's changing up your assessment tool or building out a stronger continuum or trying to divert more young people, Rewire CBT can help build readiness so that you can leverage all those. And then it's short, simple, and flexible. You don't need to teach one skill before the other. You want to use the skills that match the situation that the young person may be in. Go to the next slide. This is just and you'll get these slides. I'm not going to spend too much time here. This is just where we've been working. Again, we work with community violence intervention organizations, credible messengers, juvenile justice agencies, adult justice agencies, detention and residential facilities, and schools, and hospital violence intervention programs. And here's some of our outcomes. You know, what we do is we assess how people are sort of absorbing and using Rewire CBT when we train. What we do is we come in and we'll train, but then we build intentional strategies to help leverage the training. So it is part of the day-to-day operations of the agency or organization we're working with. Over 90% generally will say, I would recommend Rewire to a colleague. It makes me feel more effective in my work. We spend a lot of time trying to understand why young people show up the way they do. And guess what? Sometimes why we as frontline practitioners show up the way we do. And the most awesome collateral impact of this all is we see the frontline staff using the skills on themselves, because you all know, I don't have to tell anybody, this work is really hard. And a lot of times our frontline workers are coming in with their own trauma, their own stories, and these skills can help them stay in the work. And then for our law enforcement teams that we work with, 90% say it helps them manage the stress and mitigate some of their emotional reactions that they may have when they are in those situations. And then the last slide, just I think gives us some, if we can go to the next slide, some outcomes of our direct service program that JT talked about. And you can see that we have really improved behavioral health metrics, improved emotional regulation, and most importantly, we are seeing young people that we work with, that we deliver Rewire CBT to, that we give the wiggle room to practice, repeat, and fail, and get back into it. We see that they actually stay out of the justice system. And we have really great results in keeping them out of jails and detention, and keeping them in their communities. And I will leave it at that.
Oh, thank you both so much. This was really great to hear from you. You know, a lot of the time we hear we need accountability for young people in the juvenile justice system. And I really appreciate your perspective on, you know, what does that mean, and more meaningful accountability. You know, one thing that we see a lot is that young people that are engaged in violence and are under community supervision, there's not really any strategy to address their own violent victimization. So it's only accountability for when they are responsible for violence. So I was just curious if you guys could talk about that piece a little bit, how you respond to their own victimization. And like, if you guys could also touch on how you work with juvenile justice systems, how you partner or don't, and just curious about that dynamic.
I'm going to pass over to you, JT, to start that one off.
Yeah, I can answer the first piece, and then you can talk about the partner with juvenile justice. But really, that's the key, right? Most of the young people, so over 80% of the young people that we get have been in Baltimore have been gunshot victims before. So they're coming into the program with high levels of victimization already. And that's what I said. It's more about the survival that they come in with, as opposed to the actual behaviors that we see them acting out. So we start by addressing their own trauma, because here's the reality. They don't come to us as perpetrators. They come to us as victims. Regardless of whether they perpetrated a crime or not, they're still victims in our eyes, because they're the ones who have suffered from all these traumatic events that have driven them to the behaviors that we see. So we start there by addressing it. And what I always love to explain to people, look, this is not about not holding young people accountable. It's about helping young people understand why they are being held accountable and the importance of what's going on with them in their lives. And so really, one of the key things for us is addressing the victimization of them when they come in. Those are the things we want to talk about first. We want to get to the root issue of what's driving your behavior, what's causing you. This is a program that's all about them, right? It's no judgment. We don't judge what they've done. We're not here to critique what they've done. We're not here to judge or critique what they're presently doing. What we're here to do is to give them skills that help address the trauma that they suffer from, that helps address them when they're in survival mode, which will then drive them to better decisions that they choose to make on their own. Not because we told them to, not because they had to, but because they want to. So once they start to heal from their trauma, then they can start to think about other things. But I always say hurt people's favorite thing is to hurt people, right? Hurt people hurt people. So how do we start healing people so that we can help them pass that healing on? Betsy, I'll let you talk about the juvenile justice connections.
Yeah, so we partner with everybody. We'll partner with anyone who wants to partner, because we really find that Rewire CBT can be one of these things that helps us all work together. Like in Baltimore, we have almost built an ecosystem where people are sharing this language, where law enforcement has been trained in a version of Rewire. The juvenile probation has been trained. The community detention officers have been trained. And then we have a direct service program that obviously is using Rewire CBT. And when you have that, then you have like this sort of ecosystem where everyone is skill building, everyone is sharing that language, that practice and repeat opportunity is coming all the time. We work with juvenile justice agencies by training and then helping integrate Rewire into their day-to-day work. One of my favorite examples, and this sort of gets into one of the questions I see about getting parents involved, is we brought Rewire CBT to all of Maryland's probation staff and community detention staff. And I had this CD officer call me and she's like, I used Rewire. I'm like, tell me what happened. And she's like, look, I had to respond because this young person, his monitor was going off. He wasn't going in the house. He was just sitting on the stoop, but he was out of compliance. And my lever was to call 911 and have him picked up and taken over to detention. She's like, but I talked to him and I did a think, feel, do cycle with him. And I understood what was going on, which was a fight with his mom. So she walked in, she did a think, feel, do cycle with the mom, and they both slowed down enough. And they were able to use the skill of being present, just what was happening right now. The young person goes inside and they avoid the violation. They avoid the stay in detention. They avoid the court hearing. And now they both actually practice that skill together and can now take that and hopefully practice again. So we bring it to however it can be used in whatever situation you're in, whether you're working with families, and you can directly teach. We have youth-facing curriculums, worksheets, activities, all the stuff to help you use that.
That's great. And I know that there are some jurisdictions that actively partner with credible messengers. So for example, like in New York, like every young person gets a credible messenger, which is, really amazing to have extra tools in the toolbox, right? And so just want to promote that kind of option and partnership. So there are a few questions in the chat for you guys. One is about grants and funding, like how are you sustaining your efforts? And another is around assessment tools. So are you using any specific tools to help showcase kind of the changes and improvements in young people's behaviors and outcomes?
So all grants, all funding, all the opportunities that existed and hopefully will exist again, to be able to help bring this to young people all around the country. We work directly with localities, with foundations, with state, local, and federal grant making sources to bring Rewire. And we are pretty creative when it comes to funding, and also really deep in exploring Medicaid as another way to bring Rewire CBT to localities and to help them leverage that not only for reentry, but also for CVI work and working with credible messengers. And we do have tools that we use internally, and I'll put a link in that has sort of like our inquiry sort of landing page, and we can sort of give you that a little bit more specifically if you're looking for that. But then what we do, like in Maryland and what we're doing in San Francisco, a few other places, is building in to their current tools how to assess what Rewire CBT skills you really need to be focusing on, and then how that is impacting behavior change and emotional regulation over time. Our real big thing is not adding in new things, but leveraging what's there and putting it in place and sort of adding some things to what's already being done, so not to overwhelm frontline staff.
Makes total sense. Well, I really appreciate everyone's participation today as panelists. For those of you that are here listening and engaging us in the chat, feel free to reach out to us. All of this is recorded and will be posted on our website And we'll share that link. It's been shared in the chat, I think, several times, but it usually takes about a week for us to post everything. So the slides will be up and the recording. Don't hesitate to reach out if you have other questions, and just really appreciate everybody being here and discussing this important work. So thank you. Thanks to everybody for all you're doing for our young people. It's really awesome. Thanks so much, everybody. Have a great one.
Thank you all.
Thanks.